Hello, welcome back guys to my YouTube channel, and today we want to talk about SHA, Social Health Authority. So SHA ilikuwa introduced immediately after NHIF. NHIF is the National Health Insurance Fund. It has been here for the longest. Si tulizaliwa tukapata NHIF is operational, so it is what it is. And now the government in 2024 introduced SHA. Now there has been a lot of things, a lot of statements told about SHA. Some people are against it, but the government is saying it's the best thing that can ever happen to our healthcare system. Now, what is SHA? SHA is the Social Health Authority. That is SHA in full. Yeah, and there are a lot of demerits that experts, those people who have got into it ndani have realized. For example, they said it will be a financial burden on low income earners. What does this mean? It means SHA a tax of 2.7% will be, like, people will be taxed 2.7% from their salaries. What does this mean to someone who is earning below 50,000, below 30,000, or below, or maybe 50? Let us use this example, 15,000. If you're earning 15,000, let us just do the math. 2.75% of 15,000, that is around 412. 412 every month. Yule muuza makaa, yule mtu wa bodaboda, yule mama mboga atakuwa analipa 412 bob per month. And some people are also arguing that NHIF was around 500 bob yearly. So imagine, from 500 bob yearly to 412%, how much were these guys saving? Let us just do the math. Let us say 500, that is in a year, but 412 by, that is every month. So by 12 months, that will be that will be 4,944, almost 5,000 in a year. So tumetoka from 500 yearly to 5,000 yearly. It means this will really harm people. For example, how much does a mama mboga make? Because some of them argue in a good day you can even sell maybe 300 or 250. 250 in a day. That means in every month, 250 by 3, that is around 250 by 3, that is around 7,500. So no, yeah, that is it. It's around 7,500 in a month. To mean in a year, how much do they earn? You can do the math. Then unatoa 5,000 in a year. I think that math is okay for those who are earning way higher, but to the mama mbogas, to the peasant farmers, to the watu wa boda boda, it can't work. You can't just shoot from 500 to 5,000 in a year. Come on, that one I work. No. Then the second point where we're saying this SHA is a burden is everyone, a lot of people are at risk of exclusion, because the moment you fail to pay, or you fail to register, or you register late, then you might be locked out of healthcare services, because truth be told, watu wengine hawana. The rate of unemployment is also high in the country. Now, what if someone delays to pay? What will happen to them? These are the kind of questions that we should be asking ourselves every single time. Implementation challenges. implementation challenges. This SHA is new and it's complex. What we ought to have started with is teaching the people, teaching the public how this will work. Public education or public sensitization. These are the kind of things that the government ought to have done, because it is new and it is complex. Setting up digital registration areas in our rural homes, it's not that easy. Verifying incomes, making sure that this guy is saying the truth, this guy is doing this family hivi na hivi. Makiu, the other day I was in the village. I won't say they haven't done much, but they have done quite a little, because the other day I was in the village, though they are trying. The other day I was in the village, and there's this church nearby. I heard people are registering to be members of SHA just by 50 bob. So I think that is okay, but it should be free. If in a family setup there's a father, a mother, and 5 children, all of them 50 bob each, that is how much? 350. Some can't just get that. Another thing that is affecting these issues, the public trust, because a lot of people don't trust our government to be doing the right thing. They just think it's about money, it's about stealing from us, it's about corruption. So getting these people to trust the government is also something that is a factor, because we have seen people dying. We have seen people suffering because of this SHA issue, because the transition wasn't smooth. The transition from NHIF to SHA, it wasn't smooth, because people are getting to the hospital, they're being asked, umeregister SHA? Ako like, what is SHA? What is that? So it's just pain in the ass. So I think this thing should be looked into, so that our people, or the Kenyan people, can have access to healthcare, because it's a basic need. Yes. So I think those are the things that are affecting the people of Kenya as far as SHA is concerned. Subscribe to our channel for such content and even more educative content. Thank you.